Hello everyone, I'm Dr. Pavithra Nagaraj, Pediatric and Adolescent Endocrinologist working at Narayana Hospitals, Bangalore. Are you concerned that your child is having her cycles, that is periods, earlier? Or do you feel that they have pubic and axillary hair at an earlier age? Or to say even breast development before the age of the other girls attaining breast development? Or in boys, are they having an increased testicular volume or change in their voice? Yes, these are the signs of puberty. What is puberty? Is development of secondary sexual characters, that is, in girls, breast development, axillary and pubic hair, and having their monthly cycles are the signs of puberty, whereas in boys, change in their voice, increase in the testicular volume are the signs of puberty in boys. When do we label it as early? That is called as precocious puberty. In girls, if the breast development, which is called as thelarche, is before the age of 8 years, or in a boy, if the testicular volume is increased before the age of 9 years, is called as precocious puberty. So is it a concern? Yes, it is of a concern, is because of two things. One, in a girl, if the child has attained puberty before 8 years or even 9 years of age, if the girl has had her periods, that is because either there is a hormonal imbalance in the body or it must be because of the lifestyle modifications. One, why are we worried about the precocious puberty in a girl is because they would have had a growth spurt, that is, the height would have increased, but the final height would be low, or to say short. That is because the bones would have grown much beyond the chronological age, which is according to the date of birth, and the final height of the child would be short. The second point why we should worry in a girl is the psychological effect she would have if she starts having a monthly cycles, because an 8-year-old or a 9-year-old cannot take the burden of her monthly cycles. So these are the concerns in a girl. But in a boy, it's totally different. The boys having precocious puberty is not physiological, or it is not just limited to his height or psychological issues. It is much beyond. When I come to the causes, maybe I could explain why it is more concerning in boys. So the causes of precocious puberty include hypothyroidism, that is imbalance in the thyroid hormones, can cause an entity called Van Wyck-Grumbach syndrome, and that causes precocious puberty. In girls, 90% of the time it is idiopathic, that is, the cause is not known, but 10% of the cases it can be pathological. Whereas in boys, 10% are physiological, or to say the cause is not known, but 90% of the cases are pathological, or there is something which is causing increase in the hormones. So what are these causes which is increasing the hormones are some tumors which is sitting in the brain, that is in the pituitary gland, that is both in boys and girls. In girls, anything to do with the ovaries or anything increased hormones in the adrenal glands can lead to precocious puberty. Whereas in boys, anything to do with the testis, any tumors or in the adrenal glands can cause precocious puberty. So if your child is having any of the signs, that is early breast development, early periods, or early development of pubic and axillary hair in girls, or in boys, increase in the testicular volume and axillary and pubic hair with a change in the voice is a concern, and please meet a pediatric endocrinologist. Thank you.